the Trump administration's abrupt halt of the USAID Malaria Vaccine Development Program, MVDP, serves as a stark example of the far-reaching disruption to global health research since the new president assumed office. This flagship program, dedicated to preventing child mortality through the development of more effective second-generation malaria vaccines, has been brought to a standstill, leaving collaborative research teams across institutions, including Johns Hopkins University and the University of Oxford, in a state of uncertainty. The immediate order to cease all work, a direct consequence of the president's freeze on U.S. spending, has sent shockwaves through the global scientific. The consequences extend beyond malaria, with researchers expressing grave concerns about the potential for significant setbacks in other crucial areas, notably the fight against drug-resistant HIV. The MVDP's ambitious goal to significantly reduce the devastating impact of malaria on children in malaria-endemic regions is now jeopardized. In Sub-Saharan Africa alone, malaria claims the lives of approximately 450,000 children under the A. While the introduction of 2 malaria vaccines in 2024 marked a significant milestone, the MVDP's research was pivotal in enhancing their efficacy and longevity, promising a future where these life-saving interventions could offer more comprehensive and sustained protection. The suspension, initially slated for a 90-day period pending review, casts a long shadow over this progress. The uncertainty extends beyond the immediate cessation of work. The implications for ongoing research and the potential for long-term setbacks are deeply concerning. The ripple effects of this funding freeze extend far beyond the MVDP itself. Professor Kelly Chibale of the H3D Research Center at the University of Cape Town highlighted a critical project focused on establishing a platform for manufacturing essential antiretroviral active pharmaceutical ingredients in South Africa. This project, now facing an uncertain future, is vital for ensuring consistent access to life-saving medications. The disruption to this critical supply chain could have catastrophic consequences, particularly in resource-constrained settings. The potential ramifications on global health security are profound. A disruption in antiretroviral treatment supply chains can lead to alarming consequences, extending far beyond individual patients. When the concentration of antiretroviral drugs in a patient's system drops below the therapeutic threshold, the individual faces not only the immediate risk of reinfection, but also the critical threat of developing drug-resistant strains of HIV. This development not only complicates the patient's treatment, but also significantly increases the risk of transmitting drug-resistant HIV to others, accelerating the spread of this increasingly challenge. The potential for a resurgence of uncontrolled HIV infections, fueled by the disruption of treatment regimens, presents a grave and far-reaching public health crisis. The impact on global health security, particularly in vulnerable populations, is likely to be substantial and long-lasting. A State Department spokesperson, when contacted for comment, referred to a waiver issued on Wednesday concerning life-saving humanitarian assistance. However, the waiver's scope and its impact on the MVDP and similar critical research programs remain unclear. The lack of transparency surrounding the funding freeze and the limited information regarding the waiver add to the uncertainty and frustration felt by researchers worldwide. The global scientific community is deeply concerned that this abrupt halt to crucial research initiatives, driven by political decisions, will set back years of progress in the fight against preventive. The long-term consequences of this disruption to collaborative research efforts, potentially jeopardizing the development of life-saving vaccines and treatments, are far-reaching and deeply troubling, especially in the context of global health security and the ongoing struggle against infectious diseases. The need for sustained and predictable funding for global health research initiatives is paramount to ensure that advancements in disease prevention and treatment are not hindered by political instability or short-sighted policy decisions. The international community must advocate for the restoration of funding and the continuation of collaborative efforts to address the most pressing global health challenges. The future health of millions depends on it.